Sex therapists of Reddit. What are some of the most common problems you see, and what can you do to solve it? I'm a sexual health counselor, and I've actually answered this kind of question before here. But here's the copy-paste. Never stick anything in the butt you can't pull out easily. If something ends up stuck in the butt, don't try to get it out. You'll only push it in deeper. Prepare for a really weird poop. Not saying yes means no. Make sure you have consent. No, maybe. Wash your goddamn sex toys, and consider using condoms on them. They'll last longer and be more hygienic. But wash your goddamn sex toys. If you think you need to use lube, use lube. Try to use a water-based lube. Never use an oil-based lube. Never use a silicone lube on a sex toy. If they say you don't need a condom for any reason, then you need a condom. Learn how to use sex toys. Trust me, there is no shortcut to finding your perfect sexual partner. You need to experiment to find out. Don't try to inflate her vagina like a balloon by blowing into it. Don't smack the balls unless you have consent. A vibrator isn't a dick replacement. Don't be intimidated if her dildo is larger than you. Each person has a different thing that turns them on. Never assume your current partner will be turned on by what worked on the last person. Get tested. If you haven't been tested before, do it right now. Then get a subsequent test every 6 months. And don't assume you don't need protection just because both your and your partner's tests come up clean. Some STIs take a long time after transmission to register in tests. The G-spot is real. The best sex toys are either high-grade silicone, glass, or surgical steel. The latter two are also great for temperature play. Any of these three can be washed in the dishwasher. Never f***ing double wrap. You might as well not use a rubber. The friction will cause holes in both. If you're girthy, don't just shove it in. For the love of f***ing God, don't just shove it in. If you haven't f***ed before, your dick is probably going to be limp as a noodle due to stress. Shit happens. Get on your knees and express yourself with oral. It'll win you big points and probably a second chance. Don't shit yourself, unless that's what your partner is into. Don't assume your partner's going to have the same kinks 5 years from now. People's tastes change. If you're a sexy vanilla, don't be ashamed of it. Most people are. And you're potentially comparable with the majority of the people on this planet. Men, there is an orgasm button in your butt, which will give you an orgasm like you have never ever experienced in your life. You can hit it yourself, but it's easier with a partner. Good luck. The nipple is amazing, but there's a whole tit you're not paying attention to. If the sex act has a weird name, ask what's involved before you give consent. Female condoms, receptive partner condoms, have improved significantly over the years. They're a lot more comfortable, they cost less, and they give you a lot of control. As romantic as it sounds, never sleep inside you partner, have your partner sleep inside you if you're using a condom. Between shifting and shrinking, all that semen will have a nice easy opportunity to work. It's way up the sides of the rubber. If you are sharing cocks or toys with someone, use condoms and change them every time they're used on a new hole. Anyone's hole. Don't use flavored condoms for penetrative sex. They're better than nothing in a pinch, but you're pretty much asking for a yeast infection. Lastly, don't give a f*** what anyone says. If it's consensual, safe, and private, then the whole world can f*** off, except for the two of you. Do whatever feels good. Not a sex therapist, but specialized in sexual health as an agony aunt for about a decade. All humans are equally insecure about their genitals, what they look like, what they do, how they smell, everything. A good third of the stuff I did was essentially reassuring people that they weren't abnormal / someone was going to laugh at them when they got naked. Another biggie, the confessions you get of wrongdoing and sheer stupidity when someone is afraid of being pregnant or having an STI is staggering. They're all people who have an awareness of things like contraception, but either don't know all the facts or just plain ignore them. Most of these involve me trying to diplomatically suggest that they use the scare to actually use condoms consistently and maybe get tested if it sounds like they have due cause. The most common thing though was pretty cliche, and so is the response. I'm afraid. My SO wants to do this, but I'm not sure uncomfortable. I hate it when my SO does this. How can I? My SO won't do this. How do I? Yada yada, you get the point. The solution? Talk. My mind boggles how people are more comfortable at someone manhandling their genitals, regardless of their enjoyment / sense of safety, over talking about them. If you can't talk about what you're doing with a partner honestly, without fear of mockery / causing offense, you shouldn't be doing anything with them. If you should be with them at all. if you want more specific things in terms of ailments, sex acts, etc. Let me know, I've kept it pretty vague. But from my experience, when sex is a problem, it's way more to do with emotional stuff, insecurities, and relationship problems than something like logistics, though that comes up too. Also, I apologize for my poor phrasing regarding the rather heavily contested word all. Being equally healthy and natural and preferable, of course there are those who are happy with their genitals. Glad to hear it. My meaning, though I appreciate it was poorly conveyed, is that by everyone, I meant we are all equal regarding things such as age and gender, in our insecurities or lack thereof. Clinical psychologist from Germany here. I'll try to give a serious answer. A lot of problems couples have in bed result from unrealistic ideas about how good sex should be. For example, there was this one guy who told me he suffered from premature ejaculation. He was afraid that his girlfriend, who he was dating for about 2 months, would leave him because of it. He was pretty reluctant about details, so I started questioning him about previous relationships. I was pretty surprised that he never considered his stamina a problem before, so I talked to his girlfriend. As I asked her about how long her boyfriend would last, she told me in an embarrassed and desperate manner, "You know, he always finishes after only 25 minutes or so." So in that case, a little sex ed did the trick. Sexual dysfunctions, like premature ejaculation, erectile dysfunction, sexual pain, etc., are the most common problems though. The standard treatment for these, if the cause of the problem is not biological, is sort of a reprogramming of the couple's sexuality. It's called sensate focusing by Masters and Johnson. The convenient thing about this method is that you can adjust it to almost any sexual dysfunction and every couple's needs. Depending on the dysfunction, specific exercises can be added. For example, the start and stop technique for premature ejaculation, dilators for vaginismus, or masturbation, training for anorgasmia. One reason why sensate focusing works really well is that in comparison to other psychological treatments, it's actually pretty fun. Not every couple has to go through every step. If the dysfunction occurs in a later stage of the sexual response cycle, a few steps can be skipped. The couple can move on to the next step when both partners can enjoy and are relaxed during the current step. Besides, for the whole treatment, except the last few steps, full intercourse is forbidden. In a lot of cases in which the couple has regular sex before the treatment is over, their problems will come back again. Also, the sex interdiction usually takes a lot of pressure off the partner with the dysfunction and builds up a lot of excitement for the couple. Edit 2. Just to be clear, I told my patient's girlfriend that her expectations were way too high. Healthy adult males on average ejaculate after 4 to 8 minutes of plateau phase. Edit 3. As some of you have messaged me regarding problems with your partners, let me say this. I cannot give proper counseling over the internet, only some basics. If you or your partner really suffer from sexual problems, please seek professional help IRL. So one of the most common problems I see is an unequal sexual urge between partners. I'm sure most people will immediately think the issue is wives/girlfriends who don't want sex as much as their husbands, but the reverse is just as common. It pops up pretty regularly with gay lesbian couples too. Usually there's a specific reason for it. Weight gain, stress, all kinds of stuff. To give you an interesting example, a while back a couple came to me with a bunch of marital problems. The wife had a lot of complaints about how her husband had changed. He'd become less attentive, he didn't help out as much. After about 10 minutes into the session, it was pretty clear the root of the problem was that she wasn't being satisfied sexually. I asked them how many times they had sex in a week, and it turned out they had sex maybe once or twice a month. I asked the guy how often he masturbated, and he said 5 to 7 times a day. Of course, his wife was shocked. So I asked him, "What is it that arouses you in the porn that you don't get from your wife?" To which he just kind of looked away embarrassed. His wife looked at him and asked, "Please, just tell me what I can do. Who do you need from me?" He sat there quietly for a second, sighed and said, "I'm gonna need about tree fitty." It was about that time I realized that my client was a 500 feet tall crustacean from the Cretaceous era. Then I said, "God damn it, Loch Ness Monster, I ain't giving you no tree fitty." Needless to say, I counseled them to find a way to amicably separate. The one issue I discovered pretty much precluded any sort of meaningful relationship. Okay, sorry in advance as I am not a therapist, but I am friends with quite a few and work in a related field. The most common thing I hear from them is a lack of communication between the partners, particularly from patients who were raised in strictly religious homes. They don't know a lot about their own bodies or how they work, and they have so many hang-ups about sexuality that they have trouble openly discussing their issues with a partner, let alone the therapist. This issue with communication can be the basis for a lot of the other problems they face, including impotence and an unwillingness to discuss/discover the root of the problem, or lack of ability to orgasm. I hear about many women who never had anyone teach them about their bodies. and who have never taken the time to actually learn about how their genitals work, because that was dirty. A lot of older men come in requesting Viagra because they want to start dating again. Some of them have lost their wives. Some of them have had recent divorces. These men haven't been able to achieve an erection in quite some time. They get nervous when their friends set them up on dates. They believe the new women will not find their impotence attractive, so they think Viagra is the answer. I always inform them of the side effects and tell them to take it easy at first if they aren't used to having sex. Regardless, at least once a month, it never fails, a man will show back up at my office on Monday with his arm in a sling. I ask them, "Mr. Smith, what seems to be the problem?" And they tell me, "My date didn't show up." The most common theme I see in practice is people not communicating openly and honestly. The fix is simple: talk to each other. Edit: just to be clear, the fix isn't actually that simple, but I don't want to break down years of training and hours of counseling into layman terms and explain every little thing, so I shortened it to talk. My parents once were giving this advice to my sister and made her understand by telling her a story. There was a very old couple sitting at a breakfast table. The woman, after 60 years of marriage, finally had a sort of individualistic streak and decided that instead of giving her husband the soft part of the bread, like she always did every breakfast, she would eat that part herself and give her husband the crust. She hated eating crust, but today it was her husband's turn to eat the crust. She would keep what she thinks was the best part for herself. The husband smiled very happily, a smile she has not seen in a breakfast in many years. "Oh dear, thank you for giving me the crust. It is so much better than eating the soft part of the bread. Since it is always you that handle the bread, I always let you eat whatever part you wanted." Okay, I am a real sex therapist. Many of the people in this thread are making jokes, and also have no understanding of what a sex therapist does. I hope you fulfill your dream of becoming a sex therapist. It's more rewarding than any job I can think of, and you can help many people on a deep level. I'm not going to share any stories with personal clients out of respect, but I will share a little bit about what it's like. People come in, usually people who were virgins for a long time or have had some abuse in the past, with some fear of sex, and some ideas they have been marinating in for years about why it can't work with them or why they will fail. I deal mostly with men with performance anxiety. They are the most frequent patients, and they typically believe they have very severe problems. There are also a lot of older men who are fearful that their sex drive is going away, and it causes undue stress. Yes, I can tell that they are genuine. They are not just using me like a prostitute. After a couple sessions, yes, even though they pay me in full, we don't have sex the burst session, of talking, basically normal therapy, except explicitly sex-focused, I'll sit on their lap, let them put their hands on me gently, etc. Basically, I'm trying to make sure they stay present and don't fall into stress or trauma, as may be the case from their past. We only get busy when they are comfortable, at their speed. I recommend meditation before and after each session to all my patients, and also to anyone else during their free time. It helps you sit through your trauma and kind of reset yourself, keeping you more open to therapy, new experiences, and changing yourself intuitively. The overall goal is, well, it's whatever they want it to be, as long as it is a healthy goal. That's why being a sex therapist is so great. You make so many people happy on such an intensely deep level, and it's very professional. Protection is always used, and I've never had a patient get weird, stalking, asking me to be his girlfriend, etc. I recommend taking classes and talking to licensed professionals in your area to learn more about the job, classes, and if it's right for you. Good luck, PM me. Any questions you might have? Edit: I am a sex therapist. I also perform the functions of a surrogate. Many people have replied to my comment antagonistically, claiming that I am not a therapist and I am misrepresenting my profession. I have a master's degree in therapy, and my job is sex therapist. About half of my sessions do not even involve sex, and I sometimes see patients without ever having sex through their entire time with me. I am not covered by health insurers due to the surrogacy involved in my practice, but I am a sex therapist. Straight up, you Sandalsta is incorrect in saying that I am not a sex therapist. I worked in a sexual health clinic as a paraprofessional on the way to my MSWS degree. From my experience in being part of team meetings, performing intake client assessments, and learning of outcomes from senior therapists, I can say that erectile dysfunction was the easier of the diagnoses to resolve. Here's why. ED is an anxiety-based disorder. Once medical issues are ruled out, the therapist begins with addressing the basics. ED clients are certainly capable of a fulfilling sex life, however, tended to overthink and therefore rush the outcome. They are planners, and since sex starts in the brain, They often reported ways in which they planned to sustain their erection hours before the event. The solution to this is to work backwards to address that this is not about self-esteem and more about overcoming logistics. In order to distract the brain and to induce longevity, a steady commitment to pelvic floor exercises, 2-3 minutes per day, seem to help our clients immensely. I don't know about sex therapists, but occupational therapists can sometimes work with people who have disabilities and teach them socially appropriate sexual behavior. Sometimes they can teach people with physical disabilities ways to move their wheelchair or body parts that are disabled in ways that would make sex easier for them. Horrible confession. This is one of the things that made me want to change majors. I started college as an OT major. I have the utmost respect for the older generations, but there was really no way that I could make teaching, reteaching, adapting tools for sexual release for the elderly a part of my practice, and with jobs being few and far between. For the folks I saw graduating, we were advised that many of us would end up in geriatrics because that's where the jobs would be. Between that and an observation at a pediatric facility that was the most depressing thing I'd ever seen, basically a residential for minors in vegetative states, where the goal was to minimize muscle atrophy while the patient's bodies were reflexively curled into fetal at all times, I just couldn't do it anymore. Follow-up piece of info: I'm a musician and a teacher now, and I love my life and my job. I worked only with teens, but the problem I inferred from the way they spoke about sex was that they didn't feel confident standing up for what they wanted or needed from sex. If the guy didn't want to use condoms, they didn't. If the guy wasn't interested in her orgasm, she didn't have one. The girls wanted to have boyfriends, and it seemed like they thought that meant having to have sex on the guy's terms, whatever they were. I encouraged them to demand respect and to ask their partner for what they wanted. For all those asking, it is a thing. I know a girl who is in school with plans of becoming one. Yes, I did have sex with her. Yes, it was great. No, we did not sit down and talk about it after. She's just very interested in sex as a whole. She's extremely outgoing and loves talking about it. Good girl, great friend too. Haha, you're going in a tell-all book as Subject 17, aka Too Much Tongue Guy. Chapter 1, Subject 17. To give my readers a real insight into the experience of sexual intercourse, I will be writing this chapter while Forever Ina Days eats my pussy. Over the last several decades, sexual therapy has emerged as a, oh yeah, new means for frustrated couples to deal with their intimacy problems. Society has become more open and frank, yeah, that's it, lick my fucking clit about human sexuality. Due to this, the sexual therapy industry has experienced tremendous, what the fuck, growth. I have worked in the sexual therapy industry for, don't bite it, what the fuck is wrong with you, 10 years. In that time, I have learned that there is not one solution for intimacy problems. Each couple brings their own unique it's not a fucking roast beef sandwich challenges to the table, and it takes dynamic thinking and problem solving. To that's it. Get the fuck out. There's no fucking way I'm sucking your dick. I don't care how much you paid me. Address them. Tayayel. I need a sex therapist. My family mom has always made sex, masturbation, anything sexually related a no-no, and it has caused me to feel ashamed of anything to do with sex. I have had certain instances where I will be hitting it off with a girl at a bar while being out with my parents just for fun, and my mother will come up and introduce herself and just find the most awkward way to ruin the mood, asking the girl how many partners she has had, etc. I don't go out with my parents anymore, but I also don't tell them anything that happened while I was out, just because I don't want to play 20 questions about some girl I don't even know. My mom is just awkward as when it comes to sex. It makes me feel like it isn't natural. No, you just need to not have your mother around when you're meeting girls. My professor is a sex therapist, and he said his most common problem is women who are raised super religious. They're taught all their lives that sex is evil and dirty, so they repress their sexuality. But then they get married and are expected to suddenly become nymphos overnight for their husbands. And it just doesn't work like that. Thank you for watching. Write comments, put likes. Do not forget to watch other videos.